recent healthcare interaction and tell me how it went.
Recently, I had some interesting healthcare interactions that required me to go to an emergency room visit late at night in a small rural community, and it required me to then see my primary care provider after that. What's great about it was that because of the interoperability that these health systems have between each other, they were able to exchange all my records, so my primary care provider was able to see, right when I saw him, all of the reports and lab results and tests that occurred in the emergency room just the week prior, and was able to then order appropriate care for me moving forward. So even though there were 3 disparate health organizations that were working here, all of them that I saw never exchanged a piece of paper or had to require me to answer a bunch of additional information that they didn't already know because of it. So it was an interesting change of pace from the way things I think used to be, and some of the interactions I guess I've had in the past.
Let's think about what if that scenario had been different and those 2 health systems hadn't been connected and hadn't been seamlessly exchanging things electronically. What happens to patients in that situation?
There's obviously processes to get a piece of paper from one organization to another, whether it's the patient carrying it or faxes and those types of things, but it definitely wouldn't have been as efficient, and I was, even working in the system was surprising to see how well it all worked sometimes.
Let's talk about your vision. What do you hope for in the next 5 to 10 years? What will an everyday healthcare interaction look like?
We have the ability to, through Surescripts and all of the things that are going on, to be able to actually really involve the patient from the beginning to the end. I think we're in a great position to be able to help notify the patient about their own care and their understanding of it, more so than a lot of other organizations. And I mean, that's the way I would like to know.
Right, so once you've initiated a healthcare interaction, really technology ushers the patient through.
As you're sitting in your doctor's office, I could see scenarios where, oh yeah, provider's prescribing you this medication, here's 4 pharmacies in the area, these are the exact costs associated to them, which one do you want to go to? That's the experience I would want if I had to get a medication, so.
It's going to be amazing.
Yeah.